I'm genuinely glad you're here today, and I appreciate that you want to explore this important topic that concerns practically every man at some point in his life. What we'll discuss today will resolve questions you may have carried for years, and this knowledge will serve you throughout your entire life. It's information that can bring peace of mind and help you make confident decisions about your health. Here's something that might surprise you. If you're a man who's ever worried that masturbating regularly could harm your prostate health, recent research suggests the opposite might actually be true. I know this topic can feel uncomfortable to discuss. Maybe you grew up hearing mixed messages about sexual health. Maybe you've read conflicting information online that left you more confused than informed. It's completely natural to have questions about how normal behaviors affect your long-term health. What's particularly interesting is that millions of men carry these same concerns. Yet a landmark 18-year study following over 30,000 men revealed findings that challenged many long-held assumptions about masturbation and prostate health. The results were significant enough to shift how many urologists think about this topic. And here's what concerns me. While this research provides reassuring insights, many men are still operating based on outdated information that might be causing unnecessary anxiety.
I'm Dr. Elizabeth Rains, and after reviewing decades of research on men's health, I want to share what the science actually shows about your prostate, especially the important changes that happen after age 40. In the next few minutes, you'll discover what really happens to your prostate as you age, why the latest research might ease concerns you've had for years, and practical steps that can genuinely support your prostate health for decades to come. Plus, I'll share one simple food that research shows could be particularly beneficial for prostate wellness, and you probably already have it in your kitchen. The information might challenge what you've heard before, but it's based on solid science that could make a real difference in how you approach your health. Let's start by understanding what your prostate actually does. Your prostate is a walnut-sized gland with several important functions. It produces prostatic fluid that helps nourish sperm, assists with urinary control through muscle contractions, and produces enzymes important for reproductive health. Location matters for understanding symptoms. The prostate sits below the bladder and surrounds the urethra, which is why prostate changes often affect urination patterns. The natural aging process affects most men. After age 40, the prostate typically begins a gradual enlargement process called benign prostatic hyperplasia, BPH, which is different from cancer but can cause urinary symptoms. Common symptoms men notice include difficulty starting urination, weaker urine stream, frequent nighttime bathroom trips, and feeling like the bladder doesn't completely empty. Why these changes occur? Hormonal shifts, cellular changes, and natural tissue alterations all contribute to prostate modifications as men age. Understanding these normal processes helps distinguish between typical aging changes and symptoms that warrant medical evaluation. Now let's examine what research shows about ejaculation frequency and prostate health. Large-scale medical studies have examined the relationship between ejaculation frequency and prostate cancer risk with interesting findings. The Health Professionals Follow-Up Study tracked approximately 30,000 men over 18 years and found that men reporting higher ejaculation frequency had lower rates of prostate cancer development. Specific findings from this research: men ejaculating 21 or more times monthly showed approximately 20% lower prostate cancer risk compared to those ejaculating 4 to 7 times monthly. Additional supporting research. Australian studies and European research have found similar associations, suggesting this relationship appears across different populations.
The proposed mechanism. Regular ejaculation may help clear prostatic ducts of potentially problematic substances, similar to how regular fluid flow prevents stagnation in other body systems. Important context: this research shows correlation rather than causation, and ejaculation frequency appears to be one factor among many that influence prostate health. What this means practically: normal sexual behaviors, including masturbation, appear compatible with good prostate health rather than being harmful. However, this is just one piece of a comprehensive approach to prostate wellness. Understanding what happens to your prostate with aging helps you recognize normal changes versus concerning symptoms. Change number 1: gradual tissue enlargement. The prostate naturally increases in size for most men, primarily due to hormonal changes, including increased dihydrotestosterone (DHT) levels. This enlargement can gradually compress the urethra, leading to urinary symptoms. Change number 2: altered fluid dynamics. As prostate tissue changes, the gland may become less efficient at expelling its secretions, potentially leading to fluid retention and creating an environment where inflammation could develop. Change number 3: cellular metabolism shifts. The rate of cell division and replacement changes with age, and accumulated environmental exposures over decades can affect cellular health. This natural aging process is why prostate cancer risk increases with age. Hormonal factors play crucial roles. Declining testosterone combined with increased DHT conversion creates an environment that promotes prostate growth and cellular changes. Inflammation becomes more common. Low-grade chronic inflammation in prostate tissue can contribute to both benign enlargement and increased cancer risk. These changes explain why prostate health becomes increasingly important to monitor as men age. Research identifies several lifestyle factors that support long-term prostate health. Nutritional approaches with scientific support. Diets rich in lycopene, found in tomatoes, watermelon, and pink grapefruit, have shown protective associations in multiple studies. Lycopene absorption improves when tomatoes are cooked, making tomato sauce and paste particularly beneficial. Anti-inflammatory nutrition matters. Foods rich in omega-3 fatty acids, fish, walnuts, polyphenols, green tea, berries, and vegetables help maintain healthy inflammatory balance throughout the body. Hormonal factors play crucial roles. Declining testosterone combined with increased DHT conversion creates an environment that promotes prostate growth and cellular changes. Inflammation becomes more common. Low-grade chronic inflammation in prostate tissue can contribute to both benign enlargement and increased cancer risk. These changes explain why prostate health becomes increasingly important to monitor as men age. Research identifies several lifestyle factors that support long-term prostate health. Nutritional approaches with scientific support. Diets rich in lycopene, found in tomatoes, watermelon, and pink grapefruit, have shown protective associations in multiple studies. Lycopene absorption improves when tomatoes are cooked, making tomato sauce and paste particularly beneficial. Anti-inflammatory nutrition matters. Foods rich in omega-3 fatty acids, fish, walnuts, polyphenols, green tea, berries, and vegetables help maintain healthy inflammatory balance throughout the body. With healthcare providers starting around age 50 or earlier for men with family history or other risk factors. The PSA test measures a protein that can indicate prostate changes, though elevated levels can have various causes and require professional interpretation. Digital rectal examination allows doctors to assess prostate size, texture, and detect potential abnormalities that blood tests might miss. Understanding your family history helps. Genetic factors significantly influence prostate cancer risk, so knowing your family medical history helps guide screening decisions. Newer screening technologies like multiparametric MRI and genetic testing are becoming available for men at higher risk or with concerning symptoms. Symptom monitoring is important. Changes in urination patterns, pelvic discomfort, or sexual function, changes warrant professional evaluation. Early detection typically leads to better treatment outcomes for both benign prostate conditions and cancer. Creating sustainable habits that support prostate health long-term. Dietary modifications can be gradual. Start by adding 1 or 2 prostate-healthy foods weekly, rather than completely overhauling your diet immediately. Tomato-based dishes, fish meals, and green tea are easy additions. Exercise doesn't require extreme changes. Begin with walking if you're sedentary, gradually building to 150 minutes of moderate activity weekly as recommended by health organizations. Kegel exercises are simple and private. Contract pelvic floor muscles as if stopping urination midstream. Hold for 3 to 5 seconds, release and repeat 10 to 15 times, several times daily. Hydration timing matters. Drink adequate fluids throughout the day, but consider reducing intake 2 to 3 hours before bedtime to minimize nighttime urination. Stress management supports overall health. Chronic stress affects hormone levels and immune function, so incorporating stress reduction techniques benefits prostate health along with general wellness. Sleep quality affects hormone production. Maintaining consistent, quality sleep supports healthy hormone balance and cellular repair processes. These lifestyle factors work synergistically rather than in isolation. Recognizing symptoms that warrant medical evaluation, urinary changes that persist, significantly weaker stream, difficulty starting urination, frequent nighttime urination, more than 2 to 3 times, or feeling of incomplete bladder emptying. Pain or discomfort, pelvic pain, pain during urination, or pain during ejaculation should be evaluated professionally. Blood in urine or semen. While not always serious, these symptoms require prompt medical assessment. Sexual function changes. Sudden changes in erectile function or other sexual health concerns may indicate underlying health issues worth investigating. Screening schedule adherence. Even without symptoms, maintaining recommended screening schedules helps detect problems early when treatment is most effective. Don't delay due to embarrassment. Healthcare providers are trained to address these concerns professionally and confidentially. Early intervention typically provides better outcomes for any prostate health issues that may develop. Bringing together the research and practical applications, the evidence shows that normal sexual behaviors, including regular ejaculation, appear compatible with good prostate health and may even provide some protective benefits rather than causing harm. However, ejaculation frequency is just one factor in a comprehensive approach to prostate wellness that includes nutrition, exercise, weight management, and appropriate medical care. The 3 major prostate changes after 40, enlargement, altered fluid dynamics, and cellular metabolism shifts, are natural aging processes that can be supported through evidence-based lifestyle choices. Taking proactive steps in your 40s and beyond can significantly impact your quality of life and long-term health outcomes. Key action steps. Maintain regular medical screenings, incorporate prostate-healthy foods into your diet, stay physically active, and don't ignore urinary or sexual health changes. The encouraging message: you have significant control over factors that influence your prostate health through informed lifestyle choices and appropriate medical care. Remember that individual needs vary, so working with healthcare providers to develop personalized approaches typically yields the best results. Your prostate health is an important component of overall wellness and deserves the same attention you give to other aspects of your health maintenance. And for today's comment, I want to hear from you. What is one healthy habit you're going to start this week to protect your prostate? Let's support each other in the comments below. Thanks for watching, and I'll see you in the next video.